House Majority Leader Ryan Winkler, thanks for joining us.
Sure, happy to be here.
2020 legislative session right around the corner. What issues can we expect the House DFL caucus to work on this year?
We will continue to work on a lot of the issues we started on in the last session. It will be a challenge to move some of them through with a Republican Senate, but we have a lot of unfinished business. We have to work on the insulin bill, probably first and foremost, as an initial matter. We have to take on our capital investment bill and try to catch up on a lot of the projects and conditions that need to be fixed around the state of Minnesota, and so we're going to be working very hard on that. We will also continue our work on prescription drugs more generally, healthcare costs, education, and trying to address the challenge that we face in Minnesota with too many kids of color and kids from poor backgrounds not achieving in school the way we need them to. So we have a big set of needs to address in the state, and we're going to do as much as we can this session to get them addressed.
The state has a projected $1.3 billion surplus for the 2020-21 biennium. How does that factor into policy decisions that are made here at the House, and what would you like to see done with the surplus?
Well, I don't really think of it as a surplus. We have a difference in about 0.1% of projected economic growth. So last March we said that the economy was going to grow at 1.5% over the next year and a half, and now we're saying it's going to grow at 1.6%. So not a dramatic change. And that money that people are talking about as a surplus is just a projection about what's likely to come in with slightly stronger economic growth. So it doesn't make sense for us to make long-term decisions on taxes or spending with that money. If we get it, it will be a one-time set of funds, and the outlook long-term for the state still shows a very tight financial condition for the state. So we have to be very careful about how we treat the so-called surplus.
House Minority Leader Kurt Dowd said the surplus should be used to eliminate or reduce the healthcare provider tax.
It's just irresponsible. The amount of money that we get from the provider tax is long-term far in excess of any short-term bump that we're getting in extra revenue. And on top of that, millions of Minnesotans count on that revenue to support healthcare access. People with disabilities, seniors, the very ill, the very poor, a lot of people count on that money, and to try to get rid of that revenue stream on a short-term basis like this is just irresponsible.
Second year of the session typically focuses on capital investment. Governor Tim Walz has proposed a $2 billion bonding proposal, saying that it would benefit public safety, housing, water quality, higher education, other areas of need in Minnesota. Are you on board with those specific areas?
We definitely support his priorities. We do need to address water quality. We need to address a number of these things. We also need to address transportation. And we have a whole range of local projects that are vital to the success and vitality of local communities, which we also care about. So I think the governor's overall set of priorities pretty well aligns with the Senate Republicans and the House Republicans and the Democrats in the legislature. The question is going to be whether we make a commitment of any scale to address this backlog of projects.
House Speaker Melissa Hortman has voiced support for a robust bonding bill, but Republicans don't seem as enthused if the proposal starts with a 2. Will the sides be able to meet in the middle?
We will have to. In order to pass a bonding bill, we have to have support from Republicans and Democrats in the legislature, and so it necessarily will be a compromise. I do think that arbitrarily sticking to a $1 billion number doesn't really serve the needs of the state. We have this big backlog of infrastructure needs that we're not addressing, and the longer we wait, the more expensive it gets.
You've had many be heard on cannabis, community conversations around of the state. Should people expect the House to act in 2020 on legislation that would legalize recreational marijuana?
I will have a bill ready for introduction at the beginning of session for legalization of cannabis for adult use. Whether we move that bill all the way through and pass it in the House or have it heard in committee or just introduce it is yet to be determined. We have not seen much willingness from Senate Republicans to do anything on cannabis, and so the question is, how do we best present this bill, address the issues, get the conversation to the next level, and prepare ourselves for full legalization down the road.
And you talked about it on the outset here, but why hasn't there been an agreement on insulin prices?
In my mind, we have a very different set of opinions about how the healthcare system should work. Republicans want to protect the interest of pharmaceutical companies and the marketplace, who are charging 4 times and upwards of what they used to charge for the same product. Democrats think that those same companies should be brought to the table and forced to help pay for a solution that will provide insulin for more people. So it's really a question of should there be a role for the state in making sure that insulin is affordable for everybody with the industry paying part of it, or should we let the industry just take charge and decide what is the best approach for insulin for the state?
And can we expect this issue to be resolved this year?
I think we need to. I don't think anybody wants to see another life lost due to inaccessible insulin. I have a 13-year-old son who is type 1 diabetic. I understand the need for insulin. It's vital, but it's important to remember that it's one of many pharmaceuticals that people depend on for their lives, and affordability of all of them is important. And so insulin is important, but we have a whole range of pharmaceutical and healthcare issues we have to address in order to make it truly affordable and fit people's lives.
The House Subcommittee on Legislative Process Reform has been meeting during the interim, met a few times, and looking for ways to improve the legislative process. And actually it developed some proposals that would change House rules, such as budget resolution timing and separating policy and finance bills. Will the House consider these proposals this year?
So those recommendations went to the Rules Committee, which is the committee I chair.
There you go.
And in order to enact them, they have to go through the House, a vote of the House, a whole House. And so we're going to be working with Republicans in the weeks ahead to determine what's the best way to address changing the House rules. They have some views, we have some views, this committee has some views, and we're going to be working that out as the session kicks off.
And just final question, as House Majority Leader, you have some serious sway here on what happens in the body and how it operates. Additionally, DFL Governor Tim Walz has talked a lot about One Minnesota. What can be done to better promote bipartisanship between DFL members and Republican members in, let's face it, a pretty partisan environment?
Well, I feel good that we were able to get a solid budget passed with a divided legislature between the two parties. We left a lot of issues unresolved, as you were continuing to talk about with insulin. And so it's possible to do it, but it's challenging. One of the things that we tried to do in the House this year was to have the institution itself work in a more humane fashion for our staff. We tried to make sure that we didn't meet past midnight and that we were considering bills in the light of day and doing so with as much public review as possible. And we worked with Republicans to do that. So even though we might disagree strongly on policy and really go at it in a debate, we know at the end of the day there has to be a vote and a decision, and we can work together to make the process work better.
House Majority Leader Ryan Winkler, thank you very much.
Thank you.